It's time to make your life a little better.
It's a terrifying diagnosis, and more than 5 million Americans are living with it today. Here to discuss a few ways that we might be able to reduce our risk is natural medicine practitioner Dr. Jay Sordean, and to talk about ways caregivers can cope is internist Dr. Rosie Shohan. Welcome, both of you.
Thanks for being here.
Obviously, Alzheimer's, very frightening topic and frightening diagnosis all around. What do you think, Dr. Sordean, are the most important things folks should be aware of to begin with as we have the conversation?
Ronald Reagan, Margaret Thatcher, and Nelson Mandela all had Alzheimer's. Y.A. Tittle, as you know from New York, also has dementia. In the 60s, 65, that age range, there's a lot of risk factors with respect to Alzheimer's. So, number one, people who are in that age range may start to develop Alzheimer's, but there are other risk factors. They include cardiovascular problems, diabetes, inflammation, and high blood pressure. So all those different things are very important to take into account as far as a possible risk factor and starting to look to see if someone has Alzheimer's. But you don't have to be that old. Individuals who are in their 40s and 50s also could have early onset Alzheimer's. And so there's 200,000 people who have early onset Alzheimer's.
But do we know, is there an actual cause of this? Does something actually physically cause it?
Well, there is brain degeneration. The brain cells actually degenerate, and those brain cells are what helps us talk here, remember what's going on so we can track during the conversation, etc. And those cells degenerate, and that is the problem.
In terms of the cause, there is no definitive cause that has been highlighted, but there are certain risk factors that have been shown to cause Alzheimer's. Now, it's important to know that Alzheimer's is one segment of dementia, right? So when someone comes in with memory loss, it's imperative that a good physical exam and history be taken because there are some reversible causes of dementia, and those include B12 and folate deficiency, and what a biggie is hypothyroidism, actually, in elderly patients. And that, with supplements of Synthroid or thyroxine, can actually reverse the dementia associated with that. And then there's syphilis, and then you think, well, where does syphilis come from? Well, you know, in the geriatric patient population, let's say being an older kind of infection, the secondary effects of that might be present.
Right.
That's also reversible. Now, in fact, other drug-related and alcohol-related dementia can also be reversed. Not in every case, but some cases can be reversible.
So it's important to understand that Alzheimer's is one kind of dementia. You know, we used to, when I was a kid, and you'd hear the grandparents talk, it's like, oh, she's gotten senile, she's gotten batty, and it was just sort of this catch-all term for aging and forgetfulness.
In the last few years, those kind of terminologies have been changed as, you know, people have understood, and the medical profession understood that it's more important to define this very carefully because of the reversibility of some types of dementia. Now, there are some irreversible forms of dementia, and you can say, well, why are those important? Because 70% of all dementias are Alzheimer's related.
Are Alzheimer's,
but there's a few percent that is related to multi-infarct dementia, which is related to strokes and vascular problems. And you could say, well, what's the big deal about that? Because there's only a few percent. Because someone with Alzheimer's, and any one of us, can get multi-infarct dementias. So it's important to have a heart-healthy diet for physical activity. And the other thing is that people talk a lot about these brain activity exercises, brain-boosting activities. Although formal research has not shown that those are necessarily going to improve the situation or prevent Alzheimer's. That's what people want to do, is what can I do to prevent this disease?
Right.
But eating a heart-healthy diet can definitely prevent certain types of dementia. And even with Alzheimer's, if someone does get Alzheimer's, if they've got a bigger reserve of neurons, because, you know, with age, all of us lose neurons. So if you can build up your neuronal reserve by doing different things like keeping social, you know, having adaptable intellectual exercises, all these different things, and physical activity is a big aspect of maintaining brain health. All of these things are going to help.
Is there a specific symptom that people should be looking for?
Well, because early onset Alzheimer's is related to learning and the ability to learn things, typically people will start to not track well. While you're having a conversation, all of a sudden they'll drift off. And so it's really keeping track of what's going on, memory that's locked in the here and now. People often with Alzheimer's will remember things way in the past, but what's going on currently, they can't follow. They also can lose their way. They're going along,
Yeah,
and all of a
the
sudden
key-
they're lost. And
the
so
key
that's a
thing-
real issue to watch for. If there is someone else in your family who you're noticing this is going on, and they have other risk factors, it's very important for them to get examined by someone who actually knows about Alzheimer's and dementia.
But the key thing pertaining to the clip even that you saw, right? Alzheimer's cannot be diagnosed with 100% certainty in life. It is a post-mortem diagnosis. So everything that is done in life, when you go to the doctor and say, you know, what's up with my memory loss here, they can only give you a possible diagnosis of Alzheimer's. And that's why it's really important to exclude those other reversible things, because even if you end up with a diagnosis of Alzheimer's, you might have early disease. And what does early disease, how does it manifest? Is memory loss. And memory loss can be associated with aging. Memory loss can be associated with mild cognitive impairment, which is like a gray zone between aging and Alzheimer's. So what I'm saying is those first two may never progress to Alzheimer's. So it's important to understand that.
It's very difficult as well for the folks around the person who's been diagnosed, the caregivers, the family members. Talk to us a little bit about the impact on caregivers and what we can do or what they can do to make their journey a little bit easier.
The thing is, the caregiving role changes with the different phases of Alzheimer's. And depending on what you read, there can be let's just generalize and say there's 4 levels of Alzheimer's disease. So, you know, pre-senile, mild, mid, and advanced, right? And those categories are important to know because each of those categories have very different symptoms. And the role of the caregiver really changes as the disease progresses. Now, okay, we can say, and it may seem negative to say, okay, this is a progressive disease that's going to lead to death within 3 to 9 years, average about 6 years after diagnosis. But the caregiver's ability to take care of the patient is going to be better or increased if they are better educated and understand the progression of the disease. Once they get over the initial shock, they're able to know, listen, you know, I'm going to have a discussion with my loved one while, let's say, he or she is still lucid, and say, listen, you know, you might need some help with eating. You might need some help with the bills. You will not be able to drive at some point. Now, this person may not remember that you had this discussion, let's say, 5 years later.
But it's important to at
It'll
least
make you
have
feel
had it,
better
for
when
sure.
you take their keys away.
For sure. Thank you guys so much
Thanks for being here.